Infectious diseases caused by microscopic invaders like bacteria, viruses, and parasites have plagued humanity for centuries. These tiny agents of disease can spread through the air, water, food, or direct contact. They pose a constant threat to our health and well-being. Understanding how these diseases spread is crucial for developing effective prevention and treatment strategies. Vaccines and hygiene are the two pillars of our defense against these microscopic foes. Vaccines work by training our immune systems to recognize and fight specific pathogens. Hygiene practices such as hand washing and sanitation help prevent the spread of germs. Together, these measures have revolutionized public health and saved countless lives. Vaccines are one of the most successful public health interventions in history. They work by introducing a weakened or inactive form of a pathogen into the body. This triggers an immune response, teaching the body to recognize and fight the actual disease-causing agent. The development of vaccines dates back centuries, with early practices like variolation used to prevent smallpox. Edward Jenner's groundbreaking work in the late 18th century led to the development of the first true vaccine against smallpox. This discovery marked a turning point in the fight against infectious diseases. Since then, vaccines have been developed for a wide range of diseases, including polio, measles, mumps, and rubella. Alongside vaccination, hygiene plays a critical role in preventing the spread of infectious diseases. Simple practices like washing hands with soap and water can significantly reduce the transmission of germs. Proper sanitation, including safe disposal of human waste, is essential for preventing waterborne illnesses. Food safety measures, such as cooking food thoroughly and storing it properly, prevent foodborne diseases. These practices are particularly important in healthcare settings to prevent hospital-acquired infections. By adopting good hygiene habits, we can collectively contribute to a healthier and safer environment. History is replete with examples of devastating outbreaks that have shaped human civilization. From the Black Death in the 14th century to the 1918 influenza pandemic, infectious diseases have repeatedly tested our resilience. These outbreaks have taught us valuable lessons about the importance of public health infrastructure, surveillance systems, and international cooperation. The Black Death, caused by the bacterium Yersinia pestis, wiped out a significant portion of the European population. This pandemic led to advancements in sanitation and quarantine measures. The 1918 influenza pandemic, caused by a novel strain of the influenza virus, highlighted the speed at which infectious diseases can spread globally. Section 5. The Spanish flu, a pandemic that shaped the world. The 1918 influenza pandemic, often referred to as the Spanish flu, was one of the deadliest pandemics in human history. It struck with a ferocity that left the world reeling, changing the course of history in ways that are still felt today. It infected an estimated 500 million people worldwide, which was about 1/3 of the global population at the time, resulting in an estimated 50 to 100 million deaths. The sheer scale of the pandemic was unprecedented. The virus spread rapidly, facilitated by the increased global travel and troop movements during World War I. Soldiers returning home carried the virus with them, unknowingly spreading it to their communities and beyond. The pandemic had a profound impact on societies worldwide, leading to social distancing measures, school closures, and the widespread use of face masks. These measures, though rudimentary by today's standards, were crucial in slowing the spread of the virus. The 1918 pandemic highlighted the need for global cooperation and preparedness in the face of emerging infectious diseases. It underscored the importance of having robust public health systems and international collaboration. It also emphasized the importance of research and development of vaccines and antiviral treatments. The lessons learned from the Spanish flu have informed modern responses to pandemics, including the recent COVID-19 crisis, showcasing the enduring relevance of this historical event. Section 6. Polio, a near victory in the fight against disease. Polio, a highly contagious viral disease that can cause paralysis and death, was once a global scourge. The development of effective vaccines in the mid-20th century marked a turning point in the fight against this debilitating disease. The Global Polio Eradication Initiative, launched in 1988, has made remarkable progress in reducing polio cases worldwide. Through widespread vaccination campaigns and surveillance efforts, polio is now endemic in only a handful of countries. The success of the polio eradication program demonstrates the power of vaccines and international collaboration in combating infectious diseases. However, challenges remain in reaching the last remaining pockets of polio transmission. In the realm of public health, the battle against infectious diseases is a constant and evolving challenge. Section 7 focuses on emerging threats, confronting new infectious diseases. This section delves into the complexities and strategies required to tackle these ever-present dangers. The emergence of diseases such as HIV/AIDS, Ebola, and COVID-19 has highlighted the ongoing and perpetual threat posed by these microscopic adversaries. These diseases not only cause significant health crises, but also have profound social and economic impacts on communities worldwide. Many of these infectious diseases often originate in animals and make the leap to humans, a process known as zoonosis. This zoonotic transmission presents unique challenges for their prevention and control. Contributing factors include deforestation, climate change, and habitat destruction, as well as increased human-animal interactions, which all facilitate the emergence of these zoonotic diseases. Moreover, rapid urbanization and globalization accelerate the spread of these diseases across borders, making containment efforts more complex and urgent. To effectively confront these emerging threats, robust surveillance systems, rapid response capabilities, and international collaboration are indispensable. Global cooperation allows for the sharing of critical information, resources, and expertise, which is essential in managing outbreaks. Additionally, investing in the research and development of new vaccines, treatments, and diagnostic tools is crucial. These innovations can significantly reduce the impact of infectious diseases. By staying ahead of these threats through science, technology, and collaboration, we can better protect public health and ensure a safer future for all. Section 8 delves into antibiotic resistance, a growing crisis. The discovery of antibiotics once revolutionized medicine by providing effective treatments for bacterial infections. However, the overuse and misuse of these antibiotics have led to the emergence of antibiotic-resistant bacteria. This resistance occurs when bacteria evolve mechanisms to survive exposures to antibiotics that would typically be lethal. This poses a significant global health threat, as infections caused by resistant bacteria become increasingly difficult to treat. Addressing this issue requires a multifaceted approach, which includes reducing unnecessary use of antibiotics, developing new antibiotics, and promoting infection prevention measures. Moreover, international collaboration is essential to monitor and control the spread of resistant strains. Section 9 discusses the future of public health, preparing for the unknown. This section delves into the complexities and uncertainties that lie ahead in the realm of public health. The battle against infectious diseases is far from over. With new pathogens emerging and old ones resurfacing, the fight is ongoing and ever-evolving. As we navigate the challenges posed by emerging and re-emerging diseases, antibiotic resistance, and climate change, the need for robust public health systems is more critical than ever. These systems must be adaptable and resilient to withstand the pressures of a rapidly changing world. Investing in public health infrastructure, including surveillance systems, laboratories, and trained personnel, is essential for the early detection and response to outbreaks. This investment ensures that we are prepared to act swiftly and effectively when new threats arise. International cooperation and data sharing are crucial for effectively monitoring and responding to global health threats. By working together, countries can pool resources, share knowledge, and develop coordinated strategies to combat diseases on a global scale. The future of public health relies on continued innovation in vaccine development, diagnostic tools, and treatment strategies. These advancements are key to staying ahead of evolving pathogens and ensuring that we have the tools necessary to protect public health. Furthermore, public awareness and education are vital in promoting healthy behaviors and preventing the spread of diseases. By empowering individuals with knowledge, we can foster communities that are proactive in their health and well-being, ultimately leading to a healthier world for all. In our final section, we reflect on how infectious diseases have shaped human history and their impact, which continues to resonate today. From the bubonic plague to the COVID-19 pandemic, These microscopic foes have tested our resilience and ingenuity. Vaccines and hygiene practices have been instrumental in our fight against infectious diseases. However, emerging threats such as new viruses and antibiotic resistance remind us that the battle is far from over. As we look to the future, it is essential to prioritize public health, invest in research and innovation, and strengthen global cooperation. By working together, we can strive to create a healthier and safer world for all.